This segment is brought to you by MDS, Molecular Diagnostic Services.
Jessica, thank you for joining us on Living Your Best Life.
Thanks for having us, Maria.
So today we're going to talk about HPV, but before we get into that, just for the purpose of the audience, I'd like you to explain again, what does MDS do?
MDS is a private molecular laboratory. We're based in Durban. We have SANUS accreditation and we endeavour to provide our clients with a quality diagnostic service.
Perfect, thank you. So then again, what is HPV?
HPV is human papillomavirus. It's a viral infection that affects the skin and mucous membranes in both men and women. Over 100 HPV strains have been identified, with 40 known to affect the anogenital tract. It's the most common infectious disease, sexually transmitted infectious disease, and in South Africa, approximately 60% of men and women will contract HPV at some point in their lives.
Is HPV testing something that is common and all women do it?
There are a lot of stigmas attached to HPV and a lot of factors that make women afraid to get tested to start off with. For example, fear of discomfort and collection of the sample, just a general lack of knowledge and education about what HPV is, what it can cause, and why screening is so important, as well as competing health issues. If people are HIV positive, they put all their focus on that infection and not another infection that could be equally as life-threatening.
At what age should a woman start testing herself for HPV?
So the guideline is from 25 years of age, and this is because in younger individuals, infections are often transient, which means that the individual's immune system is able to clear the HPV infection itself. After 25 years, it becomes more important to test so that you pick up if there are any persistent infections which can lead to the development of cervical cancer.
How then is the HPV testing done?
Okay, at MDS we offer an HPV DNA test. This test for 14 high-risk types of HPV that are associated with the development of cervical cancer. It is able to specifically differentiate between HPV 16 and HPV 18, as well as HPV 45. HPV 16 and HPV 18 are most notable because together they cause approximately 70% of all cervical cancer cases. Our test is then also able to detect the presence of the remaining 11 high-risk types of HPV.
So just say you've been tested and you have HPV. What then are the recourses available to you?
Okay, so resources will depend on the healthcare practitioner and which resources are available to him or her, but the South African HPV Advisory Board suggests that if a woman is positive for HPV 16 or HPV 18, she should then undergo a colposcopy and or a biopsy if required. A colposcopy is an examination procedure that allows the cervix to be magnified so that a physician can check the abnormal cells and then decide whether or not a biopsy needs to be done. For women that are other high-risk HPV positive, they should then undergo a standard pap smear test so that the morphology of the cells can be checked and any pre-cancerous lesions identified.
So we spoke about the women. Let's talk about the male now. How then is a male tested?
Okay, the easiest way to test a male is to have a swab taken, either of the lesion that is present or if there is a genital wart present, swab or a biopsy of the wart can be sent in for testing.
I think one of the most important things is that there's a fear to get tested. Did you say that there are self-testing kits?
Yes, we do offer a self-collection kit. People can phone MDS and request the self-collection kit, which will then have guidelines on how the sample should be collected. Once the sample is collected, it is then sent back with the request form to MDS for testing.
Just to confirm, when you are being tested for HPV, does a practitioner have to do it, or can it just be done through you?
So there are two options available. Either a client can phone and book an appointment with the MDS sister who will then meet them, collect their sample and send it through to the lab. For clients that are not in the vicinity of MDS and they would like to send in a sample but not a self-collected sample, they could take the request form to their GP or gynae and request that an LBC sample, which is a liquid-based cytology sample, be taken and then send that sample and the request form to MDS for testing.
As women, we generally visit the gynae and have a pap smear. So is there a distinct difference between having an HPV test to having a pap smear done?
Yes, Maria, there is, and it is important to understand the difference between the two and what the end result aims to identify. So the standard pap smear has been the gold standard for identification of cervical cancer. So the principle of this difference can be explained by understanding how the two tests work. So in both, a healthcare practitioner will scrape the cells from the surface of the cervix. In the standard pap smear, these will be visualized under a microscope for any abnormalities or changes to the morphology of the cell, which will then be graded. And depending on the grade, that will indicate the stage of infection and persistence to lead to cervical cancer. Whereas the HPV DNA test detects HPV DNA in the cervical cells. So it allows for a much earlier detection at a much higher sensitivity before the cells have even started having any morphological changes that may be visualized under microscopes. This then allows the healthcare practitioner to implement early treatment with less invasive management protocols in preventing progression of the infection to a cancerous state.
So it's advisable then to ensure that you ask specifically to have the HPV virus test done.
Yes.
And finally, how often should one be tested for HPV?
Well, in a healthy individual, testing is recommended every 5 years after an HPV negative result, as long as no factors change in the interim. For example, the introduction of a new sexual partner or an HIV infection. In HIV positive individuals, the interval is a bit shorter and it is recommended that testing is done every 3 years after a negative result.
Perfect. Thank you so much.
Thank you, Maria.
This segment was brought to you by MDS, Specialist Molecular Diagnostic Laboratory, focusing on human and veterinary diseases, women's health, DNA paternity, and wellness. Contact MDS on 031 267 7000 or visit mdsafrica.net.